Welcome to Voices for a Healthy Legacy, where we have discussions about health and wellness with relatable medical professionals in an effort to improve generational health outcomes. I am your host, Dr. Andrea, a board-certified family medicine physician, and today's guest is Dr. Shameza Boyd. Welcome to the show.
Thank you for having me.
All right, so let's just start out. Just tell me a little bit about yourself, and then we'll move on with the rest of the interview.
Okay. I am Shameza Boyd, and I am a board certified pediatrician. I am born and raised in Birmingham,
Okay.
and I am the owner of Small Steps Pediatrics, which is actually located at St. Vincent's East, which is right down the street from my high school, Huffman High School.
Wow.
Yeah.
So you are from the community and you work in the community that you grew
Yes,
up
I
in.
came back home and started to practice right on the east side of town where I grew up.
Okay. And how long have you been in practice so far?
My own practice is now for 12 years.
Okay.
However, I've been a pediatrician since 2003.
Oh, okay.
Yes.
So you are very experienced in this area. So tell me what inspired you to go into medicine and then specifically with pediatrics?
So I always wanted to be a doctor. I just
Okay.
always
Me
wanted to be a
too.
doctor. I was always good at science.
Okay.
The big dilemma was whether I wanted to be a people doctor or animal doctor.
Really?
Yes. So animals were always attracted to me.
Okay.
And little kids were always attracted to me. Even as a kid, kids would come up to me, talk to me just randomly in the store. Same thing with animals.
Really?
They were just naturally attracted to me. And I was like Dr. Doolittle. I would talk to the animals.
Really?
Yes.
Even
As a little person all the way up. So I knew I would be a doctor, just which one. And I decided that I would do pediatrics because I only like certain types of animals. So I don't do birds. I didn't want to do cows and horses.
Okay.
So I said, I'll do humans and I would do pediatrics.
Okay.
I really picked pediatrics after doing my rotation in peds.
Okay.
I just felt like peds was the happy lane.
Mm.
Everywhere else, people were kind of like so kind of down, but peds, the kids are happy. Even when they're sick, they're still happy.
That's true.
And attendings were fun. And it was just a whole different world on pediatrics.
Right.
And I just felt like this is where I fit. This is my calling.
And then you're so like calm and nurturing. And so I can see that whole pediatrics thing with you. So I can completely see that. So good choice.
Yeah.
I know you see different ages. So when should children start going to the pediatrician and how often? Because different people think different things. So kind of tell us as of today, what are the guidelines or what do you think about that?
So you should actually start coming to your pediatrician after you're born, like that first 3 days. So once the baby's born, they usually will tell you in about 2 to 3 days, you need to follow up with your pediatrician. So after that, you should start seeing your pediatrician immediately.
Mm-hmm.
And we do well child checkups, which is where you come in, you get your baby's immunizations, your checkups. Those checkups are scheduled. So the schedule is 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2 years, and then every year after that. So even after your child is a teenager, they still need to be coming to see their pediatrician every single year to get that yearly checkup. And I see kids from birth all the way up until 19.
Okay.
Some pediatricians go up to 21. It's kind of a preference.
Mm-hmm.
But for me, once they graduate from high school, usually they're about 19, then I transition them to family medicine or internal medicine.
Okay. And will you talk a little bit more about the importance of those, not only, so we know within the first couple of years of life, they are seen more frequently. But if they don't have a lot going on, some people feel like, well, oh, if I'm not sick, I see it a lot in family medicine. They feel like if they don't hurt, if they're able to do the things that they normally would do, go to work, pick the kids up, take them to different activities, why do I need to stop my schedule to go and see a pediatrician, even if it's just yearly and there's nothing going on? Can you talk about the importance of those, even if there's nothing going on?
Yes, and this is very important. Kids need to see their pediatrician every single year, because even if you think they're healthy, there are certain things that we do at the exam, certain things that you just can't see that we pick up on. For example, every yearly checkup, we do their vital signs, which includes their blood pressure. We take certain lab values. I check them out. I listen to them. It's a thorough exam.
Right.
So there are certain things that you can't see if their blood pressure is elevated.
Right.
You can't see if they have diabetes. You can't see if they have a heart murmur. So these are things that I can pick up on at a routine checkup. If you wait until they're sick, it may be a bit too late. We could have started something earlier.
Right.
So routine checkups are important. It's not just about if they need shots or if they're playing sports and they need a physical. Come and see your doctor once a year.
Excellent, excellent, excellent. Thank you for that point of view. All right. So there can be some debate as to when a parent should start thickening their infant. You know where I'm going with this question. When they should start thickening their baby's formula, whether it's with the rice or the oatmeal or some other creative things out there. Will you talk about when it's medically indicated to do that and the reason why the guidelines tell us not to do it too soon?
Okay. So here's the part where we make the grandmas upset. There is no real reason to thicken the formula unless your baby has a true condition. So true conditions would be if your baby has true reflux. And by true reflux, I mean reflux that is causing them to have weight loss, where they are spitting up continuously. Every feeding, they're spitting up. So sometimes for those babies, if they're losing weight, we would suggest that the formula is thickened. And the formula is thickened to try to make it so that it is heavier, it doesn't come back up, and it's providing some extra calories so that when they do spit it up, they're still getting some caloric intake.
Okay.
It is not going to help the baby sleep through the night. I know that is what is out there, but adding cereal to the formula does not help the infant sleep throughout the night. Actually, babies are supposed to wake up to feed throughout the night. If your child had a severe dysfunction of their oral palate, they may have to have thickened formula for that reason, but that is very rare. Most people thicken the formula because they are under the assumption that if my child was not hungry and they slept, they could then sleep through the night if the formula was thickened. Misconception.
Okay. And what are so having said that, what are some things that could happen as a result of, thickening the formula? Is there anything we need to be concerned about in particular if they're doing it when they don't have a condition that necessarily warrants that?
So the big thing that usually people will find out and then they come back to me for is constipation. Because you're adding rice cereal or oatmeal cereal to the formula. It's very thick. And then the infant starts having problems with constipation. So a lot of times what I figured out is instead of having the battle between me and the grandparent and the parent about the formula and thickening the formula, if they're adding just a small amount of cereal to the formula and it's not hurting the baby, I don't really do anything. If they're adding a large amount of cereal to that formula, they will come back usually with constipation and the problem will resolve itself because they will say, I put the cereal in, my baby got constipated, so we stopped. So it can be a limiting problem.
Right.
Other things we do see is sometimes because it adds calories, it can cause them to start rapidly gaining weight.
Okay.
And we don't want that.
Right. Will you talk a little bit about constipation, kind of define it for us, and when we should get concerned and maybe get referred to someone else? When should kind of tell parents about that?
So when you have a newborn, those infants should be having a bowel movement pretty much right after they feed. But then they can start where they only have a bowel movement every couple of days.
Mm-hmm.
The importance is the type of stool that they're having. The stool should be nice and soft, almost liquidy in consistency. A lot of parents panic because they think if they hear the baby grunting,
Mm-hmm.
that they are constipated.
Right.
That's not constipation. Constipation is hard little pellet stools. I typically tell parents they'll kind of run out of the diaper because they're like little pellets. That's constipation. When babies are having bowel movements, they grunt. You should hear them grunting. They grunt because they are laying on their back. When we use the bathroom, we are sitting up. Gravity helps us have a stool. Babies don't have that. So they're grunting trying to go. That's normal. As you get older, you should start having a bowel movement every single day. It should be soft. It shouldn't be hard at all. Consistency, probably like peanut butter. If you notice that your child is not having a daily bowel movement, start looking at things that they're eating. Are they eating enough vegetables? How's their fluid intake, particularly water? Because we know we don't drink enough water. We drink sodas and juice and all the, sports drinks.
Mm-hmm.
And we don't do enough vegetables. So look at their food and water intake and increase that first. If that doesn't help, you can get an over-the-counter supplement such as Miralax. You add a little Miralax to their water, and that will soften the stools and help them go. If after doing that, they're still having problems or they're having blood in the stool, then you need to come and see a pediatrician and we can do further testing and maybe even have to do referrals to GI.
All right. So when do you think, or when is it recommended? Now, I know people do various things, and I know no two people are alike, but when should we start incorporating table food with our babies?
So this is a big debate in our community, of course.
Right.
So let's just go over the feeding in general.
Okay.
Infants, technically at 6 months, you should start feeding your infant. When I say feeding, I mean feeding with a spoon, feeding the infant soft foods. So those foods actually, it could be table food, but it needs to be like pureed table foods. Mm-hmm. So you don't have to buy the jar foods. You could puree vegetables and give that to your baby, fruits and give that to your baby, starting at 6 months. As far as actual table food, greens and things exactly from mom or dad's plate, the baby should be about at least 8 to 9 months. You want the child to be able to actually chew the food, swallow the food without choking, and to have some hand dexterity to hold on to the foods. It really does not matter to me as the pediatrician, the types of foods as far as if you make them the food, if you buy the food. But my big thing about table food is I would prefer you not do McDonald's, fries, chicken nuggets, those kinds of foods are not good for the baby. So when you talk about table foods, I think a lot of people automatically assume that I mean, when can they start eating, chicken and chicken nuggets and all of that.
Chicken wings.
And chicken wings and, so about 9 months is when I would say technically table food.
Okay.
Yes.
And will you talk a little bit about speech delay and when we should get concerned and what are some things that we can do to kind of evaluate that in our children?
So infants, when we talk about speech delay, there is a continuum for speech. So babies usually start babbling around, the initial little mama, dada, about 6 months or so. But even before that, they should be kind of cooling. Infants talk from 12 months all the way up to 2 or 3, but it's a variable of the amount that they talk and the things that they say. For me, I get concerned if an infant by 12 months is not saying anything, meaning they aren't babbling at all, no mama, da, 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 nothing, then I'm concerned. And my first concern is, are they hearing? Do they have a hearing impairment? And then it would continue, my evaluation would continue based on how that first evaluation went. After 12 months, it depends on the age and exactly what they are saying. So it's different guidelines for different ages as far as how many words they should be saying, and which is evaluated at your checkups.
Your well child check.
Your well child checkup. After the hearing evaluation, if everything is fine and the child is not talking, then we start worrying about other things such as autism. We do evaluations for that. We also have to consider environment. So one of the big questions is, how are you interacting with the baby? Who's talking to the baby? Is the baby being stimulated? Because a baby only says what they hear. So if the baby isn't being talked to, if the baby is alone, nobody is saying anything to the child is not going to talk. If you have a parent who is actively talking to this child and being engaged, and the baby is not saying anything, but their hearing is fine, then we do worry about other developmental issues. The biggest one now, autism.
Okay. All right. So will you briefly talk about RSV and when parents should get concerned about it?
Okay. So RSV has become popular because, especially after last year, the surge in cases. But RSV is basically a virus, and it attacks the small bronchioles in your lungs. So RSV not only affects babies, but it also can affect older people or anybody with any kind of immune compromise or lung disease.
Okay.
RSV used to primarily affect premature infants because those infants already don't have a good functioning lung system.
Right.
But now we've seen RSV affecting full-term babies, affecting older infants, and it's a virus that causes infants to cough, 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 and wheeze. And the problem is, as they are coughing and they're wheezing, sometimes their oxygen levels are falling. And so the big issue is the fall in oxygen levels, which leads them to be put in a hospital and having to be put on oxygen. Sometimes they also stop, eating, and they have to end up in the hospital for that reason. RSV of itself, being diagnosed with RSV, should not be concerning, because it's a virus just like so many other viruses. When it becomes concerning is if your child begins to have symptoms such as they won't eat, they won't drink. You find that they are coughing until the point where, you may see some blueness around the mouth, telling us their oxygen is low, or they're just listless. Right. They just laying around. They're breathing so hard and heavy they just can't catch their breath. Gotcha. That's when you become concerned. Okay. But they may cough with RSV for months. You may hear wheezing
that's good to know.
For a long time. And this wheezing does not respond to albuterol. So it's not like you can just give them a breathing treatment and it goes away. No, they wheeze, but most kids who have RSV, they're fine. They're running around playing. You hear them wheezing. They may cough a little bit, but they're fine.
Okay.
But it's just those extreme cases.
Okay. So we should only get concerned when when they have those specific things where they seem like they're declining and not able to play like they normally would. Okay.
That's when it becomes a concern. But just if you go to the doctor and they tell you, oh, your child has RSV, it's not, oh, I need to panic.
Freak out.
I need to take them to the hospital immediately. No.
Okay. Speaking of coughing and just illnesses that our kids get. So some parents, like for their children, let's say if they've been coughing, and adults too, but since we're talking about children and parents, we'll stick with that. Is there a such thing as taking antibiotics to get ahead of an illness? Is there ever a time when that may or may not be appropriate for our peds patients?
The simple answer, no.
That may be some exceptions. So if you can think of any,
Okay.
but because I know we hear that. Well, I see kids and adults. So just from your perspective, with the parents and grandparents or whoever the caregiver is for the child guardian.
So usually, this is how the scenario would usually go. A child may come in, they start with a cough or runny nose, and the parent says, based on some previous experience, maybe the child did have a bad infection previously.
Right.
Well, I want to get ahead of it this time, so I want you to go ahead and start them on, amoxicillin or the pink stuff or whatever, because that's what they had last time.
Flavor.
Yes, bubblegum. And thinking that, if I go ahead and start, they won't get sick like they did before. But the problem with that is I don't know if what they have now is what they had before. And most infections in pediatrics, not all, but a lot of infections are viral. Mm-hmm. So the antibiotic is not going to do anything for the infection. So the more I give them antibiotics for a viral infection, I'm just introducing more super resistant bacteria.
So we know we are in the day of kids being exposed to so many things online. Will you talk about some of the dangers that you may have seen in your practice or heard about, and how can parents kind of offset, to kind of give their kids advice of, okay, this is when you need to, do X, Y, Z. What are your thoughts on that?
So social media is a big problem with our kids, and not just social media, but phones, tablets in general, because kids are getting them so young nowadays that they're becoming attached to the phones. And these kids know how to do all kinds of things. Like these kids can work the phones better than their parents. And there are so many sites that are marketed towards kids that are predatory sites, that are adult-based sites that the kids get on thinking it's, Spider-Man, and it's not. Kids see all kinds of images that they shouldn't see. Right. So parents need to monitor what their kids are watching. There are certain ways that you can go on and block certain things from their social media, from their tablets and everything. I think that a lot of parents need to just stop giving phones and iPads to kids under a certain age. That's just, my preference. And you need to monitor it. You need to look at and kind of see what they're doing. When you look at it, if you see something concerning, you need to talk about it, because some of these little websites that the kids are going on and the language that they're using is coded.
So the talk parents, about that. They don't really know.
Yes.
It may sound innocent, but the way they group the phrases together may mean certain things. It may
mean other things. And I'm finding this out myself from some of my parents who discovered it from some of their kids. It's all kinds of things out here. I just think parents have to be on top of any type of social media. There's also a lot of bullying through social media. A lot of, good stuff is on there, but for kids, sometimes the bad outweighs the good. So I'm just not a proponent of social media for, especially the young kids.
Right.
And even the teens, because the teens, they do a lot of things that they are not supposed to do on social media, and go to a lot of sites that they shouldn't be going to. And it just can become very destructive and weigh on their mental health as well. So.
Right. And with talking about their mental health, have you seen a lot of increase in anxiety and depression with some of the teens based on those types of things?
Yes, especially with social media and bullying, because a lot of teens, even though we look at them and think, oh, they're older, they should know better. Teens do things, they put stuff out on the internet, they take pictures they shouldn't take,
Right.
and they don't understand that once you put it out there, it's out there. They think, oh, I deleted it, or, my friends wouldn't do this. Well, you can put it out there and you can delete it. But if I took a picture of
Right.
it and I sent it to several people, it still could be out there. And so you could be bullied behind something that you thought you deleted. And there's, the depression, anxiety, all of that comes to play just behind one simple mistake that you made on social media.
So what advice do you want to leave with our audience about building a healthy legacy? And it could be from whatever perspective you like.
Well, I think one thing that the audience should know is that pediatricians, we are the lowest paid specialty, but I feel like we do God's work. We are special. We take care of your children from birth all the way up until they enter adulthood. We are the unicorns of the medical society, and you should appreciate the unicorns.
We do.
And I say that, jokingly, but if you find a good pediatrician, you really should try to stick with that doctor, appreciate them, because there are not a lot of, unicorns out here. We are becoming fewer and fewer. So you want to try to establish a good relationship and don't let little things take you away from, your pediatrician or your doctor in general.
Right.
Think about the big picture. So don't let one little thing, oh, I didn't like, how the receptionist talked to me. Or I didn't like the lab person. The important relationship is between you and the child's doctor.
Right.
And that's what you need to treasure.
Right.
Because everyone out here is not a unicorn. So you need to treasure the unicorn.
Right.
Yes. And protect the relationship.
Right. And you can handle all of the other things. If they're having an issue, if they bring it to you, that's something that you can address.
Exactly.
But you are a very important part of them building that healthy legacy, because you're kind of like the building blocks, to help them through their journey. Yes. All right. So if people want to find out more about you and your services that you offer, how can they get in touch with you at your office, and how can they follow you on social media?
So you can find me at Small Steps Pediatrics. I'm located at St. Vincent's East in Professional Building 52. You can find me at my website, www.smallstepspediatrics.com. And I'm also on Facebook under smallstepspediatrics.com.
And is there a number they can call if they want to set up an appointment?
Yes, 205-868-3486.
Thank you very much.
Thank you for having me.
Thank you for tuning in to another episode of Voices for a Healthy Legacy. I am your host, Dr. Andrea, a board-certified family medicine physician. I will see you at the next episode.